We see steam pretty much every day, right? Coming off your coffee, rising from the street after it rains. But in the world of medicine, steam is something else entirely. It's not just hot water. It's this highly engineered, totally invisible ingredient that's absolutely vital for keeping patients safe. So let's pull back the curtain and see what's really going on inside the world of pharmaceutical pure steam. And this is really the whole reason we're here. Just think about it for a second. In pharmaceutical manufacturing, where you're making medicines that go directly into someone's body, the very thing you use to sterilize your equipment has to be perfectly, unquestionably pure. It's like, you can't clean a dirty dish with a muddy sponge, right? And you definitely can't sterilize with contaminated steam.
And just so we're all on the same page, the steam in your building's radiator has almost nothing in common with what we're talking about here. I mean, it's a tale of two completely different things. You've got your standard industrial steam, it's made with tap water, it's got chemicals in it to keep the pipes from rusting, and it flows through plain old carbon steel. But then, you have pharmaceutical pure steam. This stuff starts with something called water for injection. We'll get to that. It has zero additives, and it travels through super polished, specialized stainless steel. They're just not in the same league.
So why go through all this trouble? What's the big deal? Well, making sterile medicines is like a constant, never-ending battle against these invisible enemies. And contamination isn't just a little bit of dust. We're talking about things that can cause serious harm, or even be fatal to a patient.
And there are three main culprits you're always fighting against. First, you've got microbes. Bacteria, fungi, the usual suspects. Second, there are particulates, which are just microscopic specks of stuff like glass or metal. And then there's the third one, and this one's really sneaky, endotoxins. These are basically the toxic bits left behind by bacteria even after you've killed them. So see, it's not enough to just kill the germs. You have to clean up the mess they leave behind, too.
So how do you fight these invisible threats? The answer is an engineered solution. Pure steam isn't something you find lying around in nature. No, it's created, meticulously, from the ground up. And it all starts with one incredibly pure ingredient.
And that ingredient is called water for injection, or WFI. This stuff is pretty much the gold standard of pharmaceutical water. It goes through these crazy purification processes, like distillation or reverse osmosis, that strip out pretty much everything that isn't pure H2O. When you start with WFI, you're guaranteeing that your steam has the cleanest possible origin story.
And this ultra-pure steam is used in environments that are just as obsessively controlled. I mean, just look at these numbers. These are the different grades for clean rooms. A grade A zone, that's the most critical area where a sterile product might be exposed, allows for only about 3,500 tiny particles per cubic meter of air. To put that into perspective, the air in a typical city, it has millions of those particles. So this is the kind of hyper-clean world we're operating in.
Okay, so you've made this incredibly clean steam. Great, but how do you know it's pure? You can't just cross your fingers and hope for the best. You have to prove it again and again and again through this whole intense process we're going to call the Purity Gauntlet.
This gauntlet has four major hurdles. First up is design qualification, or DQ. That's basically asking, did we design the right system on paper? Then comes installation qualification, or IQ. Was it actually built and installed the way we designed it? Third, operational qualification, or OQ. Okay, does it turn on and run the way it's supposed to? And then the final boss, performance qualification, or PQ. This is the big one. Does it consistently, reliably make pure steam when it's doing its real job? It's this step-by-step process that just leaves absolutely nothing to chance.
And that final performance test really boils down to three key physical checks. First, you're testing for non-condensable gases. Too much trapped air in the steam is bad news. It acts like a tiny insulating jacket, protecting microbes from the heat. Next is dryness. If the steam is too wet, it doesn't have enough energy to do its job, and it can leave things damp, which is a big no-no. And finally, superheat. Believe it or not, steam can actually be too hot and dry. If it is, it won't condense properly on a surface to release all that sterilizing energy. It has to be in that perfect Goldilocks zone.
And then, of course, there's the chemical purity check. Remember those fever-inducing endotoxins we talked about? Well, this number here, less than or equal to 0.25 endotoxin units per milliliter, is the absolute limit. It's an unbelievably tiny amount, and it just goes to show that the steam, once it condenses back into water, has to be every bit as pure as the WFI it started out as.
Now, here's where it gets really interesting. You could have the most perfect, validated, pure steam system in the entire world, and it still wouldn't be enough by itself. It's just one part of a much bigger puzzle, a facility-wide master plan to keep everything sterile. And that master plan has a name, the Contamination Control Strategy, or CCS. Think of it like the ultimate playbook for sterility. It's this formal document that identifies every single possible way contamination could get in, and then lays out exactly what controls are in place to stop it. It's the whole blueprint.
And as you can see, the pure steam system is just one bullet point on a very long list. The CCS covers everything: the building design, the equipment, how people are trained and what they wear, the quality of the raw materials, cleaning, monitoring, everything. It just proves that sterility isn't about one single thing. It's the result of 1,000 little details all working together perfectly.
Which brings us to probably the most important idea of all, something pulled right from the official guidelines. Monitoring or testing alone does not give assurance of sterility. What that really means is you can't just make a product and then run a test at the end to see if it's sterile. That's not how it works. Quality has to be designed into the process from the very first step. It has to be built in, not inspected in. So from this simple idea of steam, we end up with a super complex, highly validated utility that's part of a massive facility-wide strategy. It's a perfect illustration of this relentless chase for purity that ultimately protects every single one of us. And it leaves us with a pretty big question, right? As our medicines get even more complex, how are these strategies going to have to change and evolve to fight the invisible threats of tomorrow?